this, would you start on the inside and work out?
But
Is that right?
I think, is it the same,
Yeah.
now,
It's
help me from the
30
policy,
seconds
is it, I think
back
it's,
and
is it,
forth.
it's the
This is
same
just-
story back and
Mhm.
forth,
Oh,
I
okay.
believe.
And you'd be using
Yeah,
that.
Is it? No, where's that?
Well,
other
where's
thing?
the, I think Sarah has it.
Yeah,
Oh,
I
right there.
do.
Oh, okay. Do you want me to read it?
I
Oops, sorry.
couldn't find it in there.
So,
Oh, okay.
But-
we'll look at
30
the,
seconds back.
I believe
Okay.
it is
Yeah,
the
it says,
same.
yeah.
But like, are you just going
see.
over the, back and forth over
I think it's a
where
2 by
the,
2.
Well, I would tend to start at the site and work out.
Yeah.
you mean like start at the top?
But
At the site
remember,
where
you've
the
got
blood
3
is.
swabs,
Okay.
so start at the site and work out, then get
Okay.
yourself another swab and start at the site and work down, maybe.
Yeah, okay. But 30 seconds total for all 3 swabs, or 30 seconds
30
per
seconds
swab?
for all 3 swabs.
Okay, so that's probably good.
And again, I wouldn't,
Do you wanna
no,
save
Drop
this?
that
No,
left
no.
thing.
Okay,
yeah, that's a good place for it.
okay. And just,
Thanks for helping us, Noah.
Oh,
Yeah.
sure.
Really.
And now I could see better if I'm, but you might even be ready to sacrifice a hand. Oh, you've got to, well, this is kind of out there, but so this is, if this was, you
I
might
wanna clean
sacrifice
that?
a hand to be able to get all the way around it.
okay. Oh,
Or
and
sacrifice,
yeah.
meaning sacrifice,
Yeah, I know what
meaning
you
that's
mean.
gonna
Make it
become your clean
clean hand.
hand in
Okay.
order so that you can do a good cleanse.
Right,
You don't necessarily have to, but you
Yeah.
might.
okay. And I,
Put them together like your idiot friend Tammy.
no way.
And
are you
then
kidding?
if you can, keep a hold of that, because when it goes down, it's gonna, this thing.
Yes.
Here,
Now,
you
would I
can-
clean this too?
You
Yeah.
will eventually, that's
Yeah.
what you've got your alcohol wipe for.
So you can
Okay.
call a friend. Can I open it
Oh,
for
yeah.
her?
Well, although that,
Except for you not sterile.
Well, I know.
but yeah.
But
You
would
put on
it-
sterile.
But
You
yeah,
would
she
probably-
called you, she
Have a
checked in to
helper.
see if you need
What you
help.
probably want to do is open this.
Everything.
I'll open everything
Oh,
before you
good.
started.
Okay. You guys are fantastic.
No, Nicole's like the sim and lab expert.
Yeah, right.
You are.
But even, see how Nicole opened it before she had it all ripped off, if you just do it halfway like she had it, then you can set it there and it'll prop itself up too.
Okay.
So like if you, like how you were stuck before where you had the clean one and you were open, if you just tear it halfway, you can sort of fold it down, it's got a little stand.
Oh,
and
okay.
sit there.
All right, so now this, I don't know what we're doing.
It's alcohol.
Yeah, and you're
You're
gonna.
gonna clean the cord.
This is for the cord.
Now,
course.
is that square, is that just a piece of paper, is that an
This
alcohol
one?
swab?
It's a label.
Oh, it's a
Yeah.
label, okay. Cause sometimes you'll have an actual alcohol swab in there too,
Might be,
so,
seems like that'd be better.
yeah.
Okay.
Or I
So-
suppose,
Yeah,
or even
then
knowing
out.
that,
Yeah.
since you've
Maybe
used this,
you
what
could-
you,
And would you just?
when you're setting up your
Kind of
field,
like
you
that?
could open up an alcohol swab
Yeah.
and dump it
Okay,
on.
That would make more sense, cause then you could put some friction on
Right,
there.
yeah, then you can get a hold of it
Yeah.
and work your way
Yeah,
down.
cause look at this, I mean, you may
Yeah,
miss
that's
it.
kinda.
You may miss a germ.
Now, would you not reuse
Yeah.
that?
Yeah.
Well, since you've got 3 of them, I would tend to, cause you're gonna have to throw them away anyway,
Right.
so.
And it says right here, never use scissors, razors, or sharp edged clamps near a central venous catheter.
Okay. All right, so now that's clean, so I'm assuming now I'm going to, since we're not putting the ointment on, I'm gonna put the gauze on.
Mhm.
But what are you showing? Go
I
ahead,
would,
show me what you're
she's
showing.
indicating you
Yes.
might wanna do a smaller gauze rather than a larger.
Oh, so they give you
gauze.
choices.
And do you
Okay.
put the one around the
No.
cord first or the blank one first? It should be around the cord first, isn't it?
Yeah.
The one that goes around it. See how
And,
it's got a cut?
and you
and
could
this needs to
choose to
dry,
do
right?
that one, or you could not, it's just gonna depend on the setting, but yeah, so go ahead
This
and,
one?
yeah, do that one.
Okay. Now, this hand is clean, this
Mhm.
hand's still sterile,
Mhm.
so I'm gonna just slip it on there, just like that.
Yeah,
And then it'll just, but probably the
It'll-
other way,
it'll
so
be-
it'll stay there.
yeah, and it'll usually just stick.
And then this one, but no, what's this
Well,
one for?
it's what's your preference?
Okay.
It's
I
sort
like
of,
this
is it just protecting or does it need absorption? That's gonna suck stuff into it, the other is just gonna protect.
We just don't
So
have,
it's
we
just
don't
kinda-
have an oozing one,
Yeah.
so we
Okay.
don't
Now,
really
I
need
would
that.
go ahead and set this down now, cause you're gonna want that over your your
Or the whole
catheter.
thing,
Yeah, so go
okay.
ahead and let that go down.
Set it there.
And then
Oops.
ideally your person's laying down so it's not gonna fall off.
Oh.
And then you can open up your
Uh-oh.
transparent. Well, okay,
Now.
let's see, let's let him.
Okay,
Fine.
so
There
this
we
is
go.
clean, and this is.
And this is clean, okay?
Well, this one's,
Yeah.
this was sterile.
Yeah.
Is it now only clean? No, it's still
No,
sterile.
it's still sterile, but you don't really need us.
Okay,
Cause it's covered up
It's,
now.
the site's
Okay.
covered up now.
so I can switch hands and
You
grab
can
with
switch
that.
hands, but why don't you just let go entirely? Let's do it.
Oh,
Okay,
okay,
good. Now, nobody
Get my tape.
blow or,
No.
Oh, this.
yeah.
Okay.
And you're gonna
No
need two
nipple.
hands to open that up, that's why.
No,
Okay.
no
What'd you say?
nipple, not no
Oh.
Nicole.
I think I found a derby name.
No nipple.
Oh no, then they'll insinuate.
Or just
No.
nipple, yeah, somehow. Nipple.
All right, just.
No, remember, so we're
So
joking, but you
do
can't go
your
over the
best.
nipple.
You really can't go over the nipple.
Well, I mean, what is Chester gonna, you know?
I'm
Ouch.
not gonna like that.
You know, he's not gonna.
And he
then-
might have
then-
hairy nipples.
And
Hairy,
what
yeah.
about when it gets
What about the
taken
chest
off?
hairs, too?
Yeah,
Yep.
it's gonna hurt.
Yeah. So do your best to.
Well, I don't know how I can avoid
So
the
I'd
nipple.
start at
It
the
is
top
supposed
and
to
then
be
hold the
chest
stuff up just a little bit.
You mean up here like
Yeah,
that?
so you're higher above it and then get your other, so now you can.
I'm still gonna hit the nipple. I'm all over the nipple. Yeah. Sorry,
Well,
sorry, Chester.
sorry, Chester.
You're all over that nipple.
But that's not a realistic size of a chest.
No, this
If
is
I was
like-
as big as my 14-year-old
Yeah,
son,
right,
maybe a bigger
right.
chest than that.
So just that we're well aware
Aware.
of the fact that of, well, and, you know, of various anatomical things that,
And there's probably smaller.
Take this out.
yeah.
See where it comes apart on the
Yeah,
side.
you gotta use both hands
Oh,
though, too.
look at that.
Make sure it stays on there.
There's probably smaller transparent
Yeah.
dressings.
Yeah, you could also find a better size. It needs to cover the, yeah, in fact, just,
Yeah,
let's see if one of those
There's-
would be.
I don't know if that
Would
one
have
is
covered
it.
It's really a close call.
So that one's
May
It
have.
probably.
that one's
I
smaller.
don't know. It's pretty tight fit.
What is it?
It would
Yeah,
cover at
that
the
maybe
top,
not,
but-
or maybe there's another one over there. Would that one, is that one big
Take your
enough?
scissors.
Biocohesive. It's the same one.
That way it's further over here.
It's the same
Or
as the one you guys were looking at.
alternately, maybe you could fold the gauze in half to make it
Oh,
smaller.
that's really smart.
Oh.
Yeah.
So it kind
Or
of didn't take up.
does
so much
it
space.
need, and this would be something I'm gonna refer you to this, does it need gauze? I think there's another
Depends
little
on
table you look at
Oh, yeah, you know, I
there
think I've
that
seen-
lets you know,
I'm on this thing here.
well, look,
where-
on the flip side, there's a table. No, just,
Here. Oh,
but maybe,
Okay.
it may be something else, but maybe
Okay,
that's.
so transparent gauze, draining exit site, this is the indications for use.
Yeah, okay.
Okay, so transparent gauze, draining exit site, needing occlusive dressing, patient comfort, or red irritated exit site.
Okay, so that's, okay, but
So
then doesn't
then-
it talk about,
Transparent.
Yeah, and then transparent is routine occlusive dressing change.
so routinely you just
Just-
have the transparent, so one of these smaller ones would work. And you
Uh-huh.
really only use the gauze if there was
If there's-
exudate, if
okay.
there was
Oh,
stuff.
So yeah,
that-
so if you said
Stuff
there was
stuck up.
some,
So
yeah,
you wouldn't even use that
drainage, you know,
You
then you would
wouldn't use the
indicate.
thing that goes
No,
over the.
no.
And you'll tell us in our
Okay.
return demo if he's oozing or not.
Yeah. Mhm.
So if he's oozing.
Well,
He
or
is,
you
no
could be
ooze.
proactive and say,
Say-
oh, there's no oozing, I
Oh.
don't.
Yeah.
There's gauze.